Disaster Lessons by Kylie McElrea.
Ebola virus disease, EVD, is a severe acute viral illness. Characteristics of symptoms as well as transmission process is seen on the screen. At this time, there is no licensed antiviral treatment for EVD, as per the Public Health Agency of Canada 2014. For the purposes of this video, we will be discussing 3 key lesson types from Canada's past for the handling of Ebola. Lessons learned. In 2009, to accelerate the vaccination manufacturing in response to H1N1 influenza pandemic, the single radial immunodiffusion SRID assay was used. Due to poor stability of H1N1, vaccine potency by SRID was recommended to develop alternative approaches. Research on a national scale for alternative methods were implemented to improve vaccination potency. In 2014, Canada learned a lesson on EVD information provided on a public health agency website, as it was too advanced for a reading level. Thus, substantial proportions of the population with low literacy levels had difficulties comprehending the key EVD messages. Readability could delay preventative measures, and so public health agencies have made substantial modifications to the readability of their information. Lessons observed. The H1N1 pandemic also taught Canada how important it is to improve information sharing among federal, provincial, and territorial partners. Although it is stated by Henry 2018 as a lesson learned, it is apparent that more integration of the national surveillance system as well as surveillance systems for First Nation, Métis, Inuit communities within Canada is needed. The lack of core competencies such as communication, leadership, and assessment and analysis of evidence-based research has proven to negatively impact the preventative measures time and time again. For instance, H5N1, the avian influenza outbreak in 2003, had political interference preventing the communication of epidemiological data only a few short months after the SARS outbreak. Keel and Alley, 2005. Lessons lost. Although collaborative efforts on a global scale assisted in the control and identification of the origin of SARS, a lesson lost is the lack of evidence-based approaches in the management of SARS. Muller et al. 2004 acknowledged that if SARS was to resurface within Canada, little evidence is available on treatment decisions for healthcare providers. Since the SARS outbreak, randomized control trials have been conducted. However, Muller et al. 2004 alluded to the fact that if an outbreak occurs again, therapeutic agents of unknown benefits will likely be used again. Thus, the same problem will repeat itself in the future. Conclusion. Through the use of core competencies for public health in Canada, hazard identification and risk assessment tools, coordination of emergency responses through emergency operations centers, and incident management systems, the Canadian Public Health Agency can improve their disaster preparedness response, taking from our Canadian history the lessons learned, observed, and lost to improve the health and safety of its people.